Hello, my name is Lisa Abed, and my presentation will be on the social work in the special needs community, middle childhood. Did you know that more than 10.2 million American children have special health care needs? And in the past decade, studies have shown that the number is on the rise. Family caregivers with children with developmental and physical disabilities experience success, yet amid struggle, growth, yet am in pain, and the possibility of finding joy in creating new dreams. As social workers, it is our responsibility to advocate and to assist the children and their caregivers. As social workers, it is our job to become the voice to those who feel unheard and to rise and beat the status quo caregivers to give the children the best quality of life possible. Today, I will be talking about what is special needs. I will also be discussing Erickson's theory, stages 1, 2, 3, and then finally stage 4, middle childhood. I will also discuss middle childhood for special needs children and the most common disabilities in middle childhood children, and finally the application to the social work practice. And then I would love to answer any questions anybody may have. So what is special needs? Special needs is an umbrella underneath which a staggering array of diagnoses can be wedged. Children with special needs may have mild learning disabilities or profound cognitive impairment, or as simple as food allergies, or something horrific like a terminal illness, developmentally delays that catch up quickly or remain entrenched, occasional panic attacks, or serious psychiatric problems. The designation is useful for getting needed services, setting appropriate goals, and gaining an understanding for children and a stressed family. Now the minuses and pluses. Special needs are commonly defined on what a child can't do. While milestones unmet, food banned, activities avoided, experiences denied, these minuses hit families hard and may make special needs seem like a tragic designation. Some parents will also always mourn the child's loss of potential, and many conditions become more troubling with time. Other families may find that their child's challenges make triumphs sweeter, and that weaknesses are often accompanied by amazing strength. Different concerns. Pick two families of children with special needs, and they seem to have little in common. However, a family dealing with developmental delays will have different concerns than the one dealing with a chronic illness, which will have different concerns than one dealing with a mental illness or learning problems or behavioral problems. There's also medical issues. For children including serious conditions like cancer, heart defects, muscular dystrophy, and cystic fibrosis, chronic conditions like asthma and diabetes, congenital conditions like cerebral palsy and dwarfism, and health threats like food allergies and obesity. Children with medical issues may require numerous tests, long hospital stays, expensive equipment, and accommodations for disabilities. Their family have to deal with frequent crises, uncertainty, and constant worry. Behavior issues. Children with behavioral issues don't respond to traditional discipline. With a diagnosis like ADHD, fetal alcohol spectrum disorder, dysfunction of sensory integration, and Tourette syndrome, they may require specialized strategies that are tailored to their specific abilities and disabilities. If those strategies are not developed and used, kids with behavioral issues throw their families into chaos and are seriously at risk for school problems, and their parents need to be flexible and creative. Developmental disabilities are some of the most devastating for a family to deal with, changing visions of the future and providing immediate difficulties in care for educating a child. Diagnoses like autism, Down syndrome, and intellectual disabilities often cause children to be removed from the mainstream, and parents must be fierce advocates to make their children receive services, therapy, schooling, inclusion, and things that they need and deserve. Children with learning disabilities like dyslexia and central auditory processing disorder struggle with schoolwork regardless of their intellectual abilities. They require specialized learning strategies to meet their potential and to avoid self-esteem problems and behavioral difficulties. Parents of learning challenged kids need to be persistent both in working with reluctant learners and with the school that provides the help these children need. A children with anxiety or depression can speak up on parents, or sneak up on parents, I should say. Problems with attachment may smack them right in the face. Living with a child with a mental health issues can put a family on a roller coaster of mood swings and crisis and defiance. Parents have to find the right professional help and make hard decisions about therapy, medications, and hospitalizations. The consequences of missed clues and wrong guesses can be significant. Although every special needs child is different, every family is unique, there are common concerns that link parents of challenged kids, including getting appropriate care and combinations, promoting acceptance in extended family, school, and the community, planning for an uncertain future, and adjusting to routines and expectations. Parents with special needs are often flexible, compassionate, stubborn, yet resilient than other parents. They have to be. Now, Erickson's theory proposes that a person progresses through 8 stages of psychosocial development, which extends throughout the lifespan. To understand middle childhood, one must discuss the previous stages 1, 2, and 3. Stage 1, trust versus mistrust. This falls in the age group from birth to 18 months. Children need to learn to trust others, or children learn to trust others, particularly their caregivers. Infants learn that they can count on their caregivers to give them food, shelter, and love, and to meet their needs. If their needs are not met, infants learn to mistrust. Stage 2, this happens between ages of 18 months and 3 years. This is called the shame versus doubt. Children learn to do things such as eat and dress independently. Through accomplishing various tasks, children gain a sense of self-confidence. If a child's independence is not encouraged or if they're punished for acting on things independently, they can develop a sense of self-doubt. This stage is really where a child of special needs start defining their needs differently. Depending on their needs, disabilities, and/or health issues, it may take a little longer, if ever, depending on some, for a child to get through this stage. For example, a child may not learn to be potty trained, or it may take several years if they ever become potty trained, or to learn to dress themselves or feed themselves. Stage 3, initiative versus guilt. This age group is from 3 to 6 years. Children is active in their own environment. They need to take initiative